Live from Times Square, it's Pop Recovery Systems, led by visionary Laura Alexis. Pop Recovery Systems, redefining surgical recovery, with bariatric expert Dr. Eric Smith. Innovating surgical preparation and recovery, Pop Recovery Systems blends nutrition, mental health, and wellness.
Breaking through the noise and changing an industry. Join Laura Alexis and Dr. Eric Smith on the Pop Culture Podcast.
Hey, friend.
What's up? I feel like it's Black Friday or something.
Now that was a good one. That was a good one. No, but that was like 2 weeks ago. You know, speaking of what you just said, did you see the video on social media showing what Black Friday looked like in 1994?
No.
People trampling each other to get into the malls and get into the stores. And I was thinking about how those long lines, my mom used to get up early to go in the long lines because they had the best pricing and stuff. And that does not happen anymore because you can just do it online.
You just do it online, and now they started a day before Black Friday. Was
and
that back
Cyber
in the
Monday.
Was that back in the Cabbage Patch days, or is that even further back? Do you remember that?
Well, 1994, I was 7 years old.
Yeah, I was like 10.
So
I think I was 10.
Yeah, right. Let's not lie, okay? The truth is better than a lie. But I'm not sure when the Cabbage Patch dolls came out.
We'll have to have Mavi do a little research for us on Cabbage Patch. But I remember, like, you know, moms were fighting in the stores, and the Tickle Me Elmo. I remember that when my kids were small. Thank God we never had a Tickle Me Elmo, but it's crazy.
Or the Arnold Schwarzenegger movie when they were fighting over that one man, the doll. He was in that movie. It wasn't Iron Man, but it looked like Iron Man. And then he ended up playing that little superhero in Jingle All the Way. All the Way. Remember
I was thinking
movie?
of like a traditional Arnold Schwarzenegger movie where like he's
kind
of thing, but no, he was like comedy.
I'm talking Hollywood.
Okay. Yeah, I do remember that now.
I love that movie. It's that time of year. It was Christmas.
It is.
Time, so.
Maybe we should have an episode on favorite Christmas movies, but not today.
No. I don't have enough of them like that. I love Hallmark during Christmas time.
Oh,
too.
yeah.
Love stories.
Yeah, I just moved my parents and had to get them new cable. And the only thing they wanted to know, they used to use like YouTube TV, and where they are, there's like Spectrum. I'll let you guess. You get 3 guesses, and the first 2 don't count of what channel they wanted to make sure they had. No, the Hallmark channel. That's all they cared about, as long as they had the Hallmark channel.
Oh,
Speaking of, this is a little reality TV trivia. I was watching the Hallmark channel with my parents not too long ago. Anna and I both were. We had dinner with them, and we thought we'd watch a little bit of TV and Christmas show or something. They have, I kid you not, they have a show on the Hallmark channel. And I want to say I'm probably going to mess this up. Let's say it's called Mr. Hallmark. It is literally a house full of men who are trying to win a role to be the leading role in a Hallmark movie. But it's like,
oh, that means they are handsome.
It's like
I need to
bachelor or bachelorette type of environment. But they're all these guys, and they're trying. Like, I never in a million years thought reality TV could go that far. But
well, it's smart. Hallmark has a certain Prince kind of look. And it's a great way to do casting and get ratings at the same time, because now you're attracting a different.
And the funny thing is the show we finished watching and it went into this one. I didn't make it very long, but when it went into that, when the host of this reality TV show was the lead character in the movie we just finished watching.
Oh my gosh, I love that. I'm gonna look that
And
up.
Believe it or not, you're never gonna believe this. He went into a small town. His car stopped working. He had to stay there in a bed and breakfast. He fell in love. Like, you're never going to believe what happened. I was shocked.
I mean, that's what I love about it. It's so good. It's the repetition. Like, you
Yeah.
kind of know it's going to happen every now and then. Like, I was just watching one and I thought it wasn't going to end the regular way. But then he ran after her at the airport and said, if I have to move to Australia, that's what I'll do. And I was like, that is so sweet. Forget my dream opportunity in Jamaica.
Yeah.
I'm going to come with you to
I don't want to be
Australia.
CEO of a company. I would just like to feed the kangaroo in the outback because I love you.
Oh my gosh. Well, everyone needs a fantasy
Yeah.
channel, and that is mine. So this week, I'm really excited because we get to just have a fun and enlightening conversation.
Yeah.
There's been so many things I've been wanting to ask you about this because you seem to be in the know more of like stuff like this when it comes to details. And the first thing I want to jump into is the anesthesiology anthem policy thing that was going to happen and then it didn't happen.
Yeah.
And I was so confused by it because they were like, anesthesiology, like your anesthesia wouldn't last for like the whole surgery or something like that. You can clear it up for us. But I was like, imagine you're in surgery and you have 2 hours left of anesthesia, but it's not covered by your insurance. So they turn it off
Dun, dun, dun.
and you awake in the middle of it. And you're like, I can feel that.
Well, that's what a lot of people felt. You know, it's funny. There was such a change in a short amount of time. We made a post about it, and in the midst of making a post about it, it changed, and we kind of had to have fun with it in our post about how quickly it changed. And we'll get to that and maybe what some of the pressures were that caused it to change. But in a nutshell, what they were saying is they were going to take CMS guidelines or these guidelines of what an average time of surgery would be. So let's say they took a gallbladder surgery, okay? And they say on average, with thousands and thousands of cases, this is about how long it should take for someone's gallbladder to be removed. That's what we're going to pay from an anesthesia standpoint for that average amount of time. So what it meant is if the time went over, they wouldn't turn the machine off. No physician would ever lack the moral aptitude to do that, right? But what it means, and it doesn't mean that the anesthesia would be stuck with the bill. The patient would have been stuck with the bill. See, you know, let's explain a little bit about how everybody gets paid when surgeries happen. And I'm going to make this in layman's terms.
I love that. Yeah.
So when I do a surgery, before I do a surgery, I have to submit to the insurance company, if I'm going through insurance, a code that's associated with that surgery. And I can't just make up a code. I have to say this code corresponds with this surgery. And there's a descriptive, description of the surgery in a book that we follow. So there's what we call CPT code, which stands for a procedure code. We submit that to the insurance company, and then they approve it based on that code. Okay. So I get paid based on the surgery, the name of the surgery or the procedure. But whether it takes me 30 minutes or 3 hours, I get paid the same. They don't pay me extra for my time. Now, granted, if I finish a little quicker, I get the same amount. But there's modifiers that you can use if you do extra stuff. But I'll be honest with you, the majority of the time, the insurance company is like, nah, you already there. You had to do that to get to where you were going. Tough luck. And if you do add a second procedure, you get paid a fraction of what it would have been if you did it by itself. So if I was doing like a gastric bypass and also did a gallbladder, I wouldn't get paid to do a gallbladder. I would get paid typically about 40% of what I would get paid for that gallbladder, adding that on. You add a third when it goes down even lower. So we get paid based on the amount of work we do, but not how long it takes, not if it's complicated or not complicated. That's it. Wow. Anesthesia charges by time. Okay, so that's just how they bill. Their billing is different than ours. They have different codes that they use to submit to the insurance company. Hospitals get what we call DRGs, and that is just a lump sum that says, on average, it takes this much money to cover the cost if somebody goes in for, let's say, a gastric bypass. And whether that patient stays in the hospital 1 night or 10 nights, hospital gets the same amount. And that's for all their costs.
Really?
That's the cost to run the OR, the staff that's required to do the procedure, the nurses, the IV fluids, the medications, all that stuff. So you've got anesthesia, the work they do, surgery, the work we do, and then the hospital, which is the arena that we do it in, and all the supplies. And that's how everybody gets paid. Anthem Blue Cross Blue Shield said, we're going to start capping anesthesia time per procedure based on these numbers. But if I get in there and you've had multiple surgeries and you've got a ton of scar tissue, I may have to spend an hour just getting to the point where I can start what I went there to do. You'll get the surgery. You won't know any different until that bill comes, because it still costs money for the medications. It still costs money for the man hours from the anesthesia. So your insurance is going to deny it. And then that remaining bill is going to get pushed over to the patient.
Wow. That's terrible.
Right. Exactly. And so you don't want somebody trying to hurry up. You don't want the surgery trying to hurry up. The reason we spoke out so much as surgeons is it really didn't impact us directly, but anesthesia is part of our team. You hear me say all the time, we're all a team. They're part of our care team. And we also, most importantly, don't want that to fall on the patient, and that financial burden to fall on the patient. So that's essentially what they were going to try to do.
Well, I saw one comment on a post about she worked in an OR. Maybe she was one of the nurses or something. And she said one time the surgeon didn't show up or something, or they were 45 minutes to an hour late. So if that were to happen, not sure if it was true or not, social media, but if that were to happen for some reason, whether it be a car accident or whatever, how would that have affected that, right? Because it's based on a certain amount of time. Yeah,
it shouldn't be a car accident because the surgeon's supposed to be in the hospital before they take the patient to the operating room. There was a case years and years ago. I just started my career, and this neurosurgeon got in trouble because he went to the bank. It's not funny, but I can't make this up. Of all places, but he went to the bank, and, it came out and the patient was under anesthesia, and I don't think there was a poor outcome, but I think he probably lost his license. This is bad. But, we have to be in the hospital for them to go to the room. I can't be driving to the hospital and say, hey, I'm the red light in front of the hospital. Go ahead and take Mrs. Jones to the operating room. First of all, I have to lay eyes on her that morning and make sure she doesn't have any questions. But if they did that and something happened to me between the car and the hospital, now she's underwent anesthesia. And even if they found out I was in a wreck immediately after, they've now exposed her to an anesthesia and the risks of the anesthesia without even having a procedure done. So there's things in place to stop that. Probably what the person was talking about is surgeons doing multiple cases a day. He or she ran over to the floor to see a patient in the ICU while they were putting their patient to sleep because they're in the same building. And what if an emergency happens? Patient codes in the ICU. Maybe he's a heart surgeon. Patient has cardiac arrest. He's going to do CPR. He's going to run the code. He's going to attend to the patient, and the patient's already asleep. And that's a rare thing that happens. But obviously, that would go against their clock of, their hours or time for that procedure.
So what was the consensus amongst, I saw a lot of posts going out, a lot, and especially the different surgeons that I follow, a majority of them were talking about it. What was the consensus? What were you guys all saying? What were the major 3 points that you were most concerned about for the team? I think
the big thing,
why this was a bad idea.
All the surgeons felt like this was a bad idea. They felt like that anytime you start to limit time, even though the surgery wouldn't be stopped, let's be hypothetical for a second. If an anesthesiologist knows consistently that the surgeon's taking longer, and they in order to get paid, they're going to have to pass part of that bill on to the patient. Well, the patient may be in a financial situation they can't pay. You can't get blood out of a turnip, as they say, right? You can send them to collections, but that's not going to get you money. what if eventually anesthesia starts? Because when we finish surgery, they don't just wake you up immediately. They slowly wean you off your medications. That's why having a good anesthesia team, knowing a surgeon really well, they know how long it takes me to do each procedure. They know when I'm on step blank, I'm almost close to being done, and they time that well. So the patients aren't under any longer than they need to be. But people start making decisions of like, oh, well, maybe we should hurry this up. As well as we all knew it's just a bad idea for the patient. We don't want any more charges being passed on to the patient, especially, when they're undergoing surgery that they need to have done. So, when patients go and have cosmetic surgery, Dr. Rednam would be a great person to ask this, and I don't want to misspeak, but I think I'm pretty accurate. If somebody's paying cash, then they tell them, hey, your abdominoplasty costs blank. And if for some reason the case goes longer, they usually don't say, hey, I need a few more $1,000s. They kind of estimate how long is it going to take me to do this? And you don't want to pass that on to a patient. But see, when you're dealing with insurance companies, you don't get to make that call. So I think the main thing is we knew it was a bad idea. We were standing up for the patient. We weren't so much standing up for anesthesia, although we are, but we knew that bill would continue to be passed down. And that's just a bad idea, because then you're going to start looking at how fast are surgeries, right? Does that mean if you've got a surgeon who takes 15 minutes longer than me, but his or her outcomes are as good as mine are, he or she shouldn't be penalized for that. His outcomes are good. Now, if he's taking twice as long, then maybe that's a surgery he or she shouldn't be doing. But now you're going to start bottlenecking people into certain places for surgery based on times and not necessarily outcomes. And that's a bad idea too.
Yeah, when I had my surgery this year, mine went a lot longer than expected because they found that encapsulated seroma. So, example like that, if it were under insurance, which it was not, then I can imagine waking up to an unexpected bill that, even if it comes later on, it's not a good feeling. No, especially when it's supposed to be something for your health. Like you feel like you're being penalized for doing something good for yourself. You know what I mean?
Yeah. Well, and not to get off on a tangent, maybe this is another episode in itself, but like when people go overseas to pay for bariatric surgery, we know, without naming names, patients that have experienced this. Yeah. They have the surgery, and then all of a sudden they find out that their blood count dropped and they need blood. And before they give them the blood, this will be X amount more. Or before you leave the hospital, oh, you got to stay an extra day? Okay, before you leave, we have to have this payment. I think that's crazy. And people have to think about that versus if someone is in the United States and they're paying and the insurance is covered, even if they pay cash, if they don't have coverage and they have a cash pay bariatric surgery, we lump all that together. We don't charge them extra if the surgery goes longer. We don't charge them extra if they stay an extra day. Yeah. What my hospital would do was they would come back to me over time and say, hey, Dr. Smith, you're having to give a lot of blood to patients, which I'm not, but you're having to give a lot of blood to patients. This is costing us more than we've estimated. We're either going to have to stop taking cash patients or we're going to have to raise the price that we're asking so we're not losing money on every case. But they would never go back to the patient and ask them to pay the extra.
Yeah. Yeah,
but when you cross the border, it's the Wild Wild West.
Yeah. In some areas, absolutely.
Yeah. Not all. Not all.
In Miami too.
I'll leave that up to you.
So also in the news was really that's still a story that's unraveling. I saw the Spine doc on Fox News. I saw a clip that she did. She was talking about there was a shooting at United Healthcare or something, the corporate, or they shot the CEO. How did they get to him?
So, well,
to him anyway,
this whole thing happening, which is still ongoing.
Right.
A lot of people believe, and that is probably why there was so much attention on the Anthem thing. So the Anthem thing was going to be in 3 states to start. I believe it was like Missouri, Connecticut, New York, or something like that. I could be wrong. But a lot of people believe that this whole CEO shooting was part of why Anthem backtracked and withdrew that, because it didn't last. It was released to the media in less than 24 hours. They came out and said, no, we're not going to do that after all.
Yeah. Wow.
So, did that play a role? It probably did. That is a very slippery slope if it did, because the last thing we need is blatant violence being needed to make positive change. And we have to be very careful with associating the two, I think, which I think, we're going to talk about.
It was more the social media that did that one, because it was social media.
I think social media did have a role in it, but a lot of the people on social media referenced that. And I think there were a few physicians that it didn't sit well with me on the tone they took. But really what happened is the CEO of United Health, and, I'm not, I don't have a person who can do a ton of research for me. I have to do it on my own. But I believe that he had been concerned about some threats previously. These CEOs of these healthcare companies or insurance companies they're very well paid. And that to me means nothing. Look, I don't know what your value is in your job and my job and everything else, and work as hard as you can. And I am happy for anybody who's being rewarded. Obviously, in that arena, it becomes controversial when someone is making a lot of money and there are people who supposedly have benefits, but they end up paying for a lot more than they thought they would pay. So I get that part. Mm-hmm. But he was at a conference. It was in New York. It was in front of a very well-to-do hotel. And this person walked up to him with a ghost gun, which is basically one that is printed with a 3D printer. They're not able to be tracked, and killed him on the street. And shot him multiple times.
What do you mean printed?
You can. They call them ghost guns, and they 3D print the guns. I mean, they're 3D printing houses now.
Oh, yeah, that's true.
Yeah. So they're not made the same way. They're not identified with, numbers. I'm not a big gun person, but they can't be traced, I guess. Now, they ultimately caught the guy with the gun, I believe, but he shot him. And in fact, he had inscripted some words on the bullet casings to send a message. And yeah, it's scary. I've had conversations with people that I know that are CEOs of a variety of companies, and it's created a lot of fear.
Yeah.
And we can talk about the healthcare side, but let's first talk about the most important thing. This guy's a father. He's a husband. He is a human, and no one deserves to be executed on the street. Like, I'm sorry. Like, this is not someone who technically committed a crime, and that's still not our role. It's not our job to say, I think he's a bad guy, let's go kill him.
Right.
Now, I don't know his ethics. I don't know his decision-making in his professional arena. I don't know I don't really care. When we're talking about the fact is if it's okay for us to speak up in a way of killing this man. It's not. And anybody that wants to, there was a lady, very outspoken on social media. It got a lot of attention from some pretty big podcasts and things where she was like almost rejoicing and like that this happened. And I'm like, we have a major humanity problem.
Well, this is the problem too, that people feel comfortable with just going out there and being like, this is okay. Like, that's where I think sometimes people take the freedom of speech a little too far, because
but that's not speech. That is action, right?
Oh, yeah.
Oh, you're talking about the people speaking out on podcasts.
Yeah.
Yes, absolutely.
Podcast. Yeah.
Absolutely.
Not him, not the person.
Yes.
So, I just feel like some things should just stay in your head.
Well, I think we've all been there, right?
Yeah.
Maybe not as severe, but no, it's true. Like, it's one thing, we should have freedom of speech, and that has been, I think, violated a lot over the past few years for a variety of reasons. But you also aren't allowed to walk into an airport and scream, "I have a gun." You will be
Right.
apprehended, and you can't, the old saying was you couldn't walk into a movie theater and scream fire. You can't create mass hysteria. If you have an opinion, you may have an opinion, but if you're saying things that may promote people and think that it's okay to take action by killing someone, like, we have lost everything. We have lost everything. Now, there is definitely some topics to discuss about why people may be fed up with the healthcare system. And I'm good with that. I agree that there's a lot of things that need to be fixed and addressed. But it's really, really bothered me to watch how a decent amount of people have tried to turn this guy into a hero. He's a freaking coward. I'm sorry. If he wants to be a hero, confront the guy, challenge him to walk up with a camera and a microphone and ask his opinion on this.
Yeah.
Protest in a way that your voice can be heard. But guess what? That is not going to change the way
him
healthcare
eliminating
works.
this one person going to change anything? All they're going to do is appoint a new CEO. Like, unfortunately for his family and things like that,
Right.
like they lost someone so valuable to them.
Right.
At the same time, it's not going to change anything. So you're right. He could have fought in a different way, with his concerns, raising them to different, they have all types of people going up to Senate and Congress and raising concerns and talking about different things. But to do it violently, I mean, I agree that that's not the way.
And I don't know the whole backstory. Apparently this guy, I think his name's is it Luigi, or it's an Italian name?
It's something.
Yeah. Anyway, I don't know.
Something. I can picture what he looks like in my head, but we'll find his name. But I think it's with the L.
He apparently suffers from a chronic back condition. I think I heard, and don't quote me on this, that he had not had the treatment that he had hoped for, became chronically addicted to pain medications or narcotics. But I'm like, how are you taking that all the way to that level?
Yeah.
And taking someone's life? Like, I promise you, his back pain is no better today by taking that man's life.
Yeah, exactly.
It's not. And, I just think it's been really concerning how people are almost applauding the fact. Well, so he got apprehended days later in a McDonald's. And the McDonald's I think it was in New York, the McDonald's, a worker at McDonald's noticed him and thought, man, it kind of looks like that guy. And they called the police and they came and they apprehended him. When people found out what happened at that McDonald's, they dropped down to a 1-star rating on Google reviews. And you know what people did? They intentionally went on in their comments when they rated him 1 star and said that the place was rat infested. There's rats everywhere. The restaurant's full of rats. Well, they're hinting that they dropped him, calling them a rat. They called the police on a guy who's been spotted murdering somebody. This isn't a healthcare issue. This is a humanity issue. And I think that's first and foremost.
Yeah. I mean, there are a lot of humanity issues going on, and we're not going to get into it. But I believe that a lot of things in the last few years that I've seen is trying to blame something, instead of take responsibility. Even some of the documentaries I've watched about people who kill people, they always try to back it to, well, they had this injury and this made them do this and this made them do that, or they were addicted to this. And as a recovering addict, I've done a lot of crazy things. I never went and killed anybody,
Right.
And it's not to say that if I didn't have some of the things in my life, like faith and family and support, but it's never an excuse. These things don't have to define your next movements.
Exactly.
And your deepest, darkest desires do not need to become a reality. Whereas all the things that are available to us today that weren't even thought of 30 years ago, or they were thought of, but they were still being built, in the basements of the tech nerds, now they're out for everyone to have, and they're able to not only visualize these things, but turn them into a reality. And so we have to be so careful on how we react as humanity and be like, oh, do we promote this? Do we support this? Or do we stand on the side of what's right? When it comes to the action itself of him killing someone, not the why behind it.
Right.
Because when
the
it
accountability
gets to death, then there is really no why. Like when you shoot somebody on the street, like you can't, the why doesn't matter. Like they're not, what are they going to turn it in from murder to manslaughter or something because he had a back pain? Like, come on.
Well, it's the accountability, and there are definitely, you can hear these stories of rage. Gosh, we just recently had a story in Kentucky of a sheriff who walked into the judge's office and killed him, shot him 10 times. Right, it's right on camera. Didn't try to hide it. This judge had been having sex with this sheriff's daughter who was underage and got her pregnant. And so you can see the rage of, oh my gosh, like,
oh my gosh.
Yeah. Oh man, we've had a lot of stuff going on. Yeah.
Way.
But at the end of the day, is it justified? No, you can't. It's not. I don't believe it's our role. Now, if that's not me and that's not my daughter, but let's say this guy, when he goes to prison,
gosh,
he speaks out about, I rage won. You can say the devil won, rage won, whatever. And I understand. Here's the thing. We never should be judged by our worst day or worst mistake. I know you and I are very grateful that we aren't. However, there's a difference in saying, well, the devil made me do it, or you say taking accountability for it and trying to be better moving forward. And not taking accountability for it sets a precedence for other people to believe that that's an okay excuse. There's lots of people who are going to spend the rest of their life in prison, but have said, here's what happened. Here's at the time what made me do it, but I take accountability for it. It wasn't my job to take this person's life. And here's the things that I can do positively to make a change moving forward, either in the prison cell or when the time I get out, right? We can all take our situations and we can do something better about it. I think you and I have had situations in our life and we're better for it. We can look back on it and we're almost grateful that we went through that because it made us a better person. And I'm not saying that we become grateful for killing someone, but you get to choose the situations in your past and what it turns into. Yeah. And you can be sorry that you took someone's life, but you can say, I'm grateful that I've learned the lesson that I can maybe help someone else not make that mistake. I think we have to not be distracted by the chaos of healthcare in the United States and lose sight of the fact that this is someone that felt like he could take this man's life.
Yeah, and I think that, one last point that I'd like to make is that the difference between the people that have the hard times and, don't move forward with those thoughts, they have surrounded themselves with support and reasons not to do that so they can think about the consequences. And I know for me, it's been a lot of attention to my mental health. Like, being able to talk through or write through or tap through or breathe through certain situations that feel overwhelming, especially in my sobriety. And so I just want to remind everyone to prioritize their mental health so that, because stories like these can really affect people if they let it. I know people like that. I'm not sure if you do, or they like when they hear certain news, you think it happened to them.
Yeah.
You know what I mean?
Mm-hmm.
So
absolutely.
I think that's important.
I think it's so important. And we talk about it all the time. Mental health isn't just when you're sorely depressed or you're, it is truly bridging that gap of the struggles that we have in life, bridging that gap of knowing what we need to do, but not being able to put it into action, even if it's an everyday habit or something as big as this. I think it's just sad because this kid, and he's a kid. I mean, he's an adult, but yet he's young. I'm sure he didn't always have this kind of rage inside of him. And I don't forget about that side of those people either. He's a human as well. Yeah. And I hope that he can find a way to better himself and not be judged by his worst mistake, moving forward. He was very well educated. If you looked at, where he had his education, and you just think, man, he's a good looking guy. He's well educated. He could have possibly confronted this guy verbally, used his platform, and started a movement to make a change.
Yeah.
Like he really, really could have. And that is, again, why I want everybody to be very careful about talking about the quote positive that came from this, because you can make movements without taking someone's lives. And just because it takes longer, I can hear the person out there right now saying, well, yeah, I've seen people go in front of Congress and I've seen them do this, but it takes forever. Nothing ever gets done. Nothing worth anything is easy.
Right.
If you get an immediate result from anything in life, I promise you it's not worth it. And putting forth the effort and the time to make a change is why it's hard. It's supposed to be hard because it truly makes a change.
Wow. I think that's where we end right there. That's like amazing. That's amazing. I'm really glad that we had this conversation. I think that it's something that needs to be said. And especially with us kind of you being very deep into the healthcare industry and me still, getting associated with it with POP and everything. I definitely wanted to have the conversation. So I'm glad we did.
Yeah. No, me too.
And if you guys ever have any questions about stuff like this, Dr. Smith, he does his own DMs on his Instagram. So if it's interesting enough, he might answer you.
Yeah. And unless it's a really weird question,
unless it's a really weird question or you're trying to insult his outfits. I do that enough, so he doesn't need that from you. But we'll see you next time on the Pop Culture Podcast.
All right. See you guys.